much of the world, obstetric fistula is an academic rarity, and 2 years ago, before the start of the war on Tigray, it was on its way to being eradicated in Tigray as well. But 2 years later, following the systematic destruction of health facilities across the region, the Fistula Center has once again become overwhelmed by women suffering from the condition. Another factor in exacerbating the number of fistula cases in Tigray has been the widespread use of sexual violence.
I begged them to leave me be, and they responded by saying, "Shut up, you agama." They raped me after I had just given birth. It was 2 Eritrean soldiers. They took turns raping me. 3 days later, I realized I couldn't control my urine. I only had 1 child, and they killed him.
Another patient we met at the center says that because medical facilities in her village were destroyed, she had to give birth in her house. Her labor lasted 5 whole days, after which she was no longer able to control her urine.
I was home during labor. It lasted for 5 days. I couldn't go to a hospital. I gave birth at home. I couldn't control my legs. They would just lean to one side. I couldn't control my bowel movement after that.
Even after a year of the traumatic incident that left these women incontinent, both are yet to heal, as medical treatment remains out of reach.
I'm in a terrible situation. I can't control my urine. I feel a horrible pain in my uterus as well.
Medical Director of Hamlin Fistula Center, Dr. Malako Abraha, and coordinating nurse Azib Kalayu on their part say that the center is on the verge of collapsing due to the blockade on all essential items, including medical supplies.
ናይ ምግቢ ናይ ጽሬት ናይ ሕክምና መሳርሒ መመርመሪታት እውን በተዘለው ከባን እጽዋን
We haven't been able to provide food or food sanitation materials as well as items necessary for diagnostic because of the siege. We are on the verge of closing our doors.
ሓደ ዓመት ሙሉ ምንም ነገር የብሉ ካብና ሰራሕተኛ ደሞዝ ጀሚሩ ማለት እዩ ለተን ሕሙማት ለብጀተለን በጀት ምንም ነገር የለም.
The center hasn't had anything for a year now. Since last June, we haven't had salary for staff or a budget for the patients. We're reaching a point where we can no longer provide care for those desperate women.
This facility, the only one treating women with fistula cases in Tigray, just like all of Tigray's health system, has been exhausted by the ongoing siege, prolonging the suffering of these women and their families.